What the flip is up with Donald Trump's Medicare executive order? That's up next on What the Flip. Hello, welcome to What the Flip. I'm your host, Victor Vogel. I want to wake up all senior citizens and anyone on Medicare and those who are relying on Medicare for that matter to be careful and watch in the future. Donald Trump recently ceremoniously signed an executive order that he said strengthened Medicare. He signed this order with a host of senior citizens around him who are obviously ignorant about the impact of the executive order on their Medicare benefits in the future. First, let me give credit to a Pulitzer Prize winning journalist, Michael Hiltzik, who wrote a great article in the LA Times about this topic. I will put the link to the article in the description of this podcast. I'll be quoting Michael extensively to help you understand what is going on with Trump's Medicare executive order. First, let me begin by saying it has been the Republican Party's goal to destroy Medicare from the beginning. They view it as far back as Reagan as a socialist program. Their desire has always been to privatize Medicare. Now I'm going to refer and quote much of Michael Hiltzik's article because I think it clearly lays out the true intent of Trump's Medicare executive order. Because I want every person who is currently relying on Medicare to be scared as hell about this executive order and to send this podcast viral through the elder community and anyone who has currently dealt with Medicare or might think they are going to rely on Medicare in the future. You know, when I talk to senior citizens about Medicare and their treatment, most are satisfied but totally oblivious to how Medicare works to save them money and how doctors, hospitals, and insurance companies want Medicare destroyed. Let's begin with Michael's accurate assessment of the impact of Trump's Medicare executive order. Michael says, quote, "The victims will be the 60 million seniors who depend on Medicare for their health care. Their costs would go up, and their access to benefits will shrink." Close quote. You heard right, 60 million seniors. By the way, that is the power block we have as voters, so keep that in mind. Two critical points. Your costs will go up more than any Social Security increase that you will receive, and your benefits will be less. These are critical points to keep in mind, and here's why. According to Hiltzik, quote, "First is a mandate that the Secretary of Health and Human Services examine raising traditional Medicare reimbursements to more closely reflect the prices paid for services and Medicare advantages and the commercial insurance market." Close quote. This basically means Trump wants the Medicare costs to be raised to the level that your doctors outside of Medicare are currently receiving for the same services. Michael further says this would completely destroy the chief advantage Medicare has over commercial insurance, its cost structure. Medicare pays physicians, on average, about 40% less than commercial plans. Hospitals receive half to two-thirds from Medicare what they do from the private insurers, according to the Rand Corporation. Close quote. Basically, the money barons like hospitals, insurance companies, doctors, and pharmaceutical companies support this move because it will force Medicare to pay prices more in line with these lobbyist prices. To make it clear, Medicare recipients' cost will increase greatly. and their benefits will be reduced. Things like free labs and other tests, and healthcare prices will begin to soar in America, far above everywhere else in the world. That brings us to the most popular of these plans out in the market today, the Medicare Advantage plan. You know, just find a Medicare person enrolled in the plan and simply ask them how it works. You might get a list of benefit it offers, but not how the plan works. Michael Hiltzik gives a clear explanation of Medicare Advantage plans. In traditional Medicare, the government sets reimbursement rates and coverage limitations and provides the program's administration. Under Medicare Advantage, private insurers receive a set fee per enrollee from the government, but they can offer more services like vision and dental and coverage and a host of other come-ons to lure customers such as acupuncture, health club discounts, transportation to the grocery store, and even home pest control, close quotes. But there are drawbacks. Medicare Advantage plans impose narrow networks of doctors and hospitals on enrollees and often don't cover medical expenses while traveling. Most important, they've been accused of ripping off the government by charging well more than they should. A 2016 report by the Government Accountability Office placed the excess at $14.1 billion in 2013 alone, according to Michael. Now, keep in mind, you have a large portion of the 60 million people using these plans where the provider gets double the profit of group insurance and individual insurance plans. So why do they get a double profit for Medicare Advantage plans? It has to do with those questions you answer about your health, and Michael puts it pretty clearly. Quote, Medicare Advantage is a device for cherry-picking the lowest-cost seniors out of the Medicare pool. They are the seniors whose health care needs can be filled by a narrow network of doctors and who can make use of blandishments and things such as the gym memberships. Close quote. In other words, they select Advantage members based on the probability that they won't need to use the plan, except maybe for the gym. This creates a situation where the more costly cases remain in traditional Medicare, which in turn drives Medicare cost up for all. Basically, Trump wants to privatize Medicare. There are a lot of reasons why that is a bad idea for consumers of health care and a windfall for doctors, hospitals, insurance companies, and pharmaceutical companies. Just one more point that makes this executive order dangerous for all who are using and would use Medicare in the future. Trump touts that his executive order will make pricing transparent. First, there is a lot of resistance to the idea of making pricing transparent from guess who? Doctors, hospitals, insurance companies, and pharmaceutical companies. It's to their benefit to keep us in the dark. Secondly, more doctors are beginning to contract with hospitals versus work for them, which takes the price charged out of the hands of the hospital and puts it into the hands of the contracting doctor, who can charge much more. So what happens? An in-network hospital may have an out-of-network doctor contracted in an emergency room. The patient arrives and they're hurting. They're sick. The out-of-network doctor sees them initially. The hospital then admits the patient, who receives mostly in-network services from that point. When they get home, they receive a bill from the emergency room doctor in far excess of what the insurance company would pay, and the patient has a surprise expense. This happens a whole lot. And for a major illness like heart surgery, that bill might bankrupt a person. Trump's solution to this problem is to require hospitals and doctors to make their charges transparent to the patient so the patient can negotiate. He likes to negotiate. This is a very bad idea. First, patients have no idea about the pricing a doctor sets, how they set their prices and what they premise the pricing on, or anything about the cost of medical facilities or pharmaceuticals or anything else. Secondly, if you are in the emergency room like I was with a fractured femur in pain, you're in no condition to negotiate a price or wait for a family member to arrive and negotiate a price. This is just a stupid executive order which does not address reality. Those who are rich never have to worry about those situations. For the 99% of us, it can be a negative, life-changing event. So to kind of summarize, you need to take the time to review and understand everything about Medicare and not just take the experts, the insurance company, the doctors. Don't take their word for it. Don't take their advice. They tend to favor what makes them richer. Most of all, never believe what Trump says about Medicare. He and the GOP aim to privatize health care. To know more about why that doesn't work, listen to my podcast entitled Take Healthcare Out of the Free Market. The link will be posted in the description below. This is What the Flip, and I'm your host, Victor Vogel. You need to be scared of anything Trump does with Medicare. Get active.